Thank you to Asia Society for organizing this. Really pleasure to be here, with all of the panel members. I think just a few comments. We started a piece of research in about mid-December, Teach for India and BCG. At that point of time, while we were expecting schools to open after a long period of time, and suddenly all of the schools actually went back into closure because of COVID third wave. And for all of us who work in the education space, that was quite distressing, that while after a year and a half, we were expecting schools to open, they went back into closures. So we decided to look at what's happening around the world with respect to school closures. And what we found was very different from India. What we found was that in a majority of the world, in many international countries, schools had not remained closed for the last year and a half. Yes, in the first wave, most schools had shut down. But over the second and third waves, countries had learned how to keep schools open. For 2021, we found that 60 to 70% of the countries had their schools open for 70 to 80% of the time. And what we also saw was that school opening and closing decisions were decentralized to a very small unit of governance at a school level. So a school could decide if they want to stay, close for a week or so if there's a surge in cases, but it wasn't that whole countries or whole state systems were actually shutting down. What we also did, and this is from an educator's perspective or a data analyst perspective and not from a public health perspective, we also looked at whether in the countries where schools had remained open or were kept open, was there a different progression of the disease? Was there a different sort of mortality rate for children? And this is all based on gross data, and would love to hear Dr. Shetty's views on all of this. We did not see a different progression of the disease. We did not sort of see that in countries where schools were open, more kids were getting sick, more kids were getting admitted into the hospitals, or kids were actually having an impact back on their communities, where the community incidence of the disease was actually going up. Again, looking at the data from a gross perspective, that's what we saw. It's good news that schools have opened in India for the most part. I think through the month of February, most of the states have announced school openings, and we expect that by 1st or 15th March, all schools in the country will be open. But we worry about three things. One, we worry about parent hesitancy. Even where schools have opened, and Dr. Vakil will be able to speak to this perhaps, a lot of parents are still hesitant of sending their kids to schools, especially in sort of urban upper income households. A lot of parents are not sending kids to schools, and that puts pressure back on the school as well as the governments to wonder whether they made a mistake by opening schools, because parents are not sending kids to school. So I think one is an issue of parent hesitancy. The second is an issue of repeat closures. Yes, it's great that schools have opened. What if we hope not, but what if we have another sort of incidence of rising cases? Will schools close again as they have over the last 1.5 to 2 years? We as educators want to advocate for two things. Schools be the last to close and first to open, rather than schools being the first to open and last to close. And secondly, even as schools have to close, the decision making be decentralized, either to a district level or a sub-district level or to a village level, rather than a full state announcing all of its schools actually getting closed. So that's the second. Will schools close again? That worries us, and when and how. And third is, I think as an educator, what Shaheen and I and perhaps Dr. Vakil worry about is that as we reopen schools, 80 to 90% of India's kids who go to affordable private schools or government schools have lost nearly 1 to 2 years of schooling. We talk about digital devices, we talk about digital learning. We know how poorly that is available to kids outside of high-end private schools. So as we think about bringing kids back to schools, how do we manage for that loss of learning? How do we manage for that loss of even social emotional development that they would have experienced in their schools and communities? And as we rebuild our education system, how do we build a better education system? So those are the three things that we worry about. Those are what we've mentioned in the report. Perhaps this is useful context as we get into a discussion. Govind, over to you now to help us take this conversation forward.
Right. Thank you so much for this, Seema. I think you've put together a lot of data on this. And I think if you mentioned, or at least your report mentions, that India is only the second country in the world or the second country in the world to keep the schools closed for the longest period. Is that right?
Of the countries that we studied, and which was all of the large countries, that is accurate. That is accurate.
Right. Okay. Let me come to you, Dr. Shetty. So I think we're dealing at two or three things here. I think there is the health and the medicine part, and then there is the educational outcomes part. So how do you approach this, or how are you looking at both these issues from your perspective as a health professional? Let me get a broad view from you, and then we can go deeper.
Thanks, Govind. First of all, let's look at closure of the school. Was it needed when the COVID just happened? It was absolutely required 1.5 years ago, when country was they reached a pandemic stage, wherein closure was the only option, because we had no idea about this virus. We had no idea what the virus will do on the human body. Then we had no idea what the virus will do to the children. So closure of the school was the only option. But over a period of time, we learned how to manage the virus. We knew what is the worst thing COVID can do. And also we realized that the COVID has a soft corner for the children. So over a period of time, we were fairly sure that children are safe, because even if they got the viral COVID virus, they are less unwell compared to the adults. And it continued like this. The greatest fear was the new variant called Omicron. When that happened, again, there was uncertainty. And I was one of the many doctors who went forward and said that, look, we have no idea what this new variant is, and we should be ultra cautious. See, it's good to compare ourselves with England and US. But the issue is, what are the number of children in those countries compared to our children? That is one question. Second question is, what infrastructure we have if in every city just 2,000 children get infected badly with COVID? We simply do not have. When it is a question of adults, India is fairly well prepared. But for the children, unwell children in the ICU, we have a serious problem. We don't have that many ICU beds. We don't have that many ventilators. We don't have that many expert nurses and the doctors who take care of the children. The only way we could protect them, save them, is by protecting. So we would have reacted rather aggressively in advising for closure. But now picture is fairly clear. Now I am fairly certain that time has come for us to start the school and not to bother about what is going to be the next wave. There is a very, very strong possibility that the next wave will pass off like the third wave, Omicron wave, what we have gone through. Even virus will mutate. It may behave differently, but it is unlikely to be more vicious than the recent wave. So now there is no justification for us to keep the schools closed from the medical point of view. God forbid if worst thing happens, if you get that, we can always close it later. There is no point in keeping it closed now.
Right, but if I were to ask you a perfect hindsight question, when would you have opened schools if you could have opened schools?
Yes, that's a very good question. I think I would have opened the school at least 1 to 1.5 months earlier. Yeah. In fact, I wrote an editorial in one of the newspapers that we have to learn to live with the COVID, and time has come for us to accept that COVID is not going to go away. It is not going to go away for at least 2 more years. There will be few endemic waves of COVID coming in different parts of the country, but it won't spread like what it spread earlier. And it is pointless now to keep the children away from school.
Right, and I'm going to come to our educators on the panel in a moment. But if you were to look at this as a matter of risk perception, Dr. Shetty, between the many diseases that people are exposed to and the likelihood of them getting it, how would you calibrate someone's response, if you could, when it comes to telling parents about allowing the children to go, stressing on the importance of going to school versus, let's say, staying at home, and obviously feeling that there is a sense of protection?
Yeah, I like the term feeling of sense of protection by staying at home. I'll give you my personal experience. I have 4 children and 5 grandchildren. We took the utmost precaution. As my children are, a good number of them are doctors, my son-in-law is a doctor. You can imagine how the household of doctors are going to be. And we went overboard in protecting all of them. All of them, 11 of my family members got infected with COVID. 11 of them, including my grandchildren, all of them got infected. But by the grace of God, they didn't even need any of those, any of the drugs required other than just to control the medicine. That goes to show that if you keep your children well protected at home, it is not a protection. If they will, because the virus is so infective, it will get them. And it is better in this kind of a context. Now we are confident to send our grandchildren to school because they all had a immunity. They had the infection. God willing, they will be protected. And even if they get one more episode of COVID virus, it is likely to be very mild because they are already immunized. And none of my grandchildren are vaccinated, by the way, yet. They're too small. So essentially, I feel that now preventing the children from attending the school is not a very wise thing. It doesn't justify, because keeping them at home also, you can't protect them. So it is better they go to school, and even if they get it, generally COVID behaves in a very mild manner.
Right. Okay. I'm going to come back to you on the vaccine question as well, because this is a public health approach. How do we get vaccines faster to younger children? For example, in the US, if that's an example, children 5+ can now take both doses of vaccines with a small gap. Shaheen, a few quick words from you on how you've seen this phase and its impact on children.
Yeah, thanks, Govind. Just a few thoughts. I'm not an expert on the health side, so I have not, I guess, ventured to have an opinion on when we should have opened and when we shouldn't. I think my real worry is in the way that decisions were taken. It did not feel like we had brave leaders who were looking at data and evaluating the medium and long-term implications of school closure on children. And as an educator, that to me was very worrying. I think building on what Dr. Shetty said, my own experience working with low-income kids was children were everywhere. They were not sitting at home. They were out in the communities. They were going to malls. They were going to restaurants. And yet they were denied school. And my puzzlement is, at the time when we felt it was okay for people to go back to offices, to go to bars, to go to restaurants, why at that point did we not value schools and education at the same level as these other issues? And I think there's a much deeper issue of voice and children being voiceless, not being a vote bank, not really understanding the implications on them. And I think there's a real issue of power as well. A lot of the voices that were swaying the conversation were higher income parents who were able to keep the learning of their children going, whereas the children I work with, which are the vast majority of kids in the country, didn't have access to hardware. They were not able to learn. They were sinking into poverty. They were confined to a 10-foot by 10-foot room. And it's had very, very, I would use the word catastrophic implications on our children.
Right. And that's the moot point, Shaheen. Dr. Vakil, can I get you in for a very, very quick input here on as a school principal? How have you managed this? I don't know if it's a balance, but between wanting to open the school, and I'm assuming that was your position, versus parents who did not want it to be open.
To some extent, I think parent hesitancy is a myth. As soon as we opened, in October, and then in December, and now full school a few weeks ago. From week 1, we hit 85% attendance. Out of the remaining 15%, 10% were either out of town or were quarantined, and you had 5% or less who were hesitant and sort of waiting in the wings. I suspect if you did a survey and asked the hesitant parents how valuable they found schooling, you would find a strong correlation between wanting to go to school and the value they saw in schooling, right? So I think a lot of parents felt that a cocktail of tutorials on one hand, some other form of instruction on the other, preparing through exam guides, etc., is sort of, they were okay with it. And that is the problem, and that it actually reveals a larger malaise in the system where a large number of policymakers and parents view education as in terms of exam results, certificates, means to an end. And therefore, not surprisingly, even in 2020 and 2021, when all the schools were shut, there were lots of attempts to have and run exams. In every crisis, what gets revealed are the priorities of society and policymakers, and the priority clearly was economy number 1, entertainment and travel number 2, education number 3, and even within education, it was the board exam going classes. When, as Seema rightly mentioned, in many other parts of the world, primary schools opened, both because the impact of school closure was higher on them, and secondly, because the health risk to the younger ones was less.
Right. Okay, Dr. Shetty, let me come back to you. Many of these students who've lost these 2 years now are potential doctors. Maybe many of them in 10, 15 years' time will work in your hospital or chain of hospitals. How do you see this? And, if you were to look at them now as people who are going to be operating on others or treating others, you really want people who've been through consistent, good quality education to the extent the system delivers that, and be confident that they've learned the right things, which is not just, I'm assuming, cracking the exams every 6 months.
Thanks, Govind. Fortunately, it is only the undergraduate medical education got impacted to some extent. However, at the fag end, they also started attending the hospitals, and they were involved in, to some extent, COVID care as well. So medical education didn't get that much degree of impact because of the loss of classroom lectures. But I'm not saying it didn't have an impact, but it is marginal. Because all the specialist doctors undergoing training, they were in the midst of the COVID war. So they had a phenomenal exposure to very, very rigorous training during this time. But we are definitely concerned about the school children, because aspiration to become doctors happens when they are in 7th, 8th standard. And those kids, once they are out of the circulation, when they stop interacting, they miss out on, school education, what you study is only a small part of what the children get exposed in the school. For me, school was never a place where I learned new things. It was about interacting with my friends and generally developing the skill to manage ourselves in this world. So that is something which is missing, and I guess it will have some impact, especially children coming from poor families who are not exposed to all these digital tools to educate themselves. They had no exposure to parents who can teach them complex problem of what education is. There is no guidance. So they were virtually rudderless for the, during this period. It is sad. I hope we are able to make up in some other way in the next 1 to 2 years' time.
Right, Dr. Shetty, I know you have to leave us in a little while. So let me get a few thoughts from you as you look ahead. Now, as Seema also said, this is something, and as everyone knows, I guess, this is something that can very well turn around and come back into our lives. In what form, we don't know. But if that would be the case, or is likely to be the case, how do we approach this in a way that is, maybe more either structured or equitable?
See, first of all, COVID has taught us a lot of lessons. In the next 1 year or 2 years, the medical community will come up with a proper protocol so that we don't react to these kind of epidemics with a knee-jerk reaction. That is going to happen, and we are definitely trying to convince all the senior doctors that time has come for us to create some kind of a blueprint or the guidelines as how do we manage during the next pandemic or epidemic, if at all it happens. That's the first thing. The second thing is the whole world has come to know the importance of education, especially healthcare education. There is a shortage of 80 million healthcare workforce across the world today, even before COVID happened. And COVID exposed the soft underbelly of healthcare system of the world. Forget about India. Now, in the process, what is going to happen is every country is going to invest heavily on healthcare. Now, that means they are going to have more workforce in the first world countries. And simply they don't have that much of healthcare workforce in those countries. And healthcare profession is not a very attractive profession for children who were born in rich families and rich countries. So we in India, if we can reorganize ourselves about the objective of education in India and see how we can entice these children to get into healthcare education, there is a phenomenal opportunity for them. I'll give an example. Nursing is the only profession in the world where a girl born in a very poor family in rural West Bengal or rural Karnataka at the age of 23 can earn 1.5 to 2 lakh rupees per month by being just a nurse after 4 years. So this is a great opportunity we have. And I feel that our education system should create an avenue for these children to go into these type of areas for a massive job opportunity.
Right, and that, I guess, is something that from a public policy approach we should be surely thinking of. Let me also pose, just to come back on a health medicine point, the issue of vaccines. A lot of parents, for instance, say that, if my child had vaccines, I would have surely sent her or him earlier. Or even today, if my child has vaccines, I would not hesitate or be afraid of sending them to school.
See, right now, we do not have that kind of a data available to say that vaccine is the game changer in children who are going to be infected with the COVID right now. And also, the number is too small. And it is a matter of time before this type of vaccines will become like a routine pediatric vaccination regime. So it will happen. But right now, I don't think any parent would be hesitating to send their children to school just because their children are not vaccinated. Because all the children who got infected, the way they have behaved without vaccination, we haven't seen a great difference between the kids who are vaccinated and unvaccinated. Having said that, the number of vaccinated children are very, very small. I really don't think that should be a point for the parents to decide in sending the children to school or not sending children to the school.
Right. But would you advocate that the government focus on lower age groups now, going below 15?
I think we should be governed only by the data, and based on the data we should decide, because you have seen how the vaccine hesitancy is even for the adults. So without strong data, we shouldn't really push for massive vaccination among the children. Yeah.
Right. And, Seema referred to this point that, yes, if there is another wave, how do you decentralize or disaggregate your response? For instance, if maybe there are more cases in North Karnataka, then you can close schools in those parts of North Karnataka, but not all of Karnataka and surely not all of India. So do you think from a public health, public policy point of view, we are ready to move in that direction, or how could we move in that direction?
See, the first thing is if there is a next wave, we should stop the mass testing like what we have done. We do not do mass testing for dengue. We don't do mass testing for malaria or any of those diseases, because mass testing will lead to kind of a fear among all the parents, and all kinds of pressure comes on the policymakers. Policymakers ultimately react to the demand of the people. So they will take knee-jerk reaction, then we all suffer with it. So we shouldn't be thinking about large-scale testing. Like some child has a symptom or adult has a symptom, then we do the COVID test. And if they are positive, they are treated accordingly. That will reduce the mass hysteria significantly. And it's very, very unlikely that we will go through what we have gone through, because looking at how these pandemics behave in the past, like Spanish flu, I can tell you that if there was no COVID testing, COVID wave was over during the second wave. After that, there is no COVID wave, because at the peak of COVID, third wave with Omicron, our positivity in the hospital, where we had more than 800 patients during the second wave, our ICU occupancy was some 27 patients. And we converted 1,000 beds as COVID ICU. We converted every bed as a COVID ICU. And we are waiting for that many patients in case there was a disaster. When the positivity rate of 55%, there are only 29 patients. That is the time we realized that it is over. Now we should stop testing. But unfortunately, we kept on testing till recently. Every day we were getting the news that this many 55,000 patients are positive or 70,000, but nobody reports how many patients are in the hospital when most of the COVID beds are empty. I think in future, if we have to go through this, we should only talk about hospitalization, not positivity. That will change the people's perception about the disease entirely.
Right. I mean, Mumbai, where I am, for instance, breaks up in daily cases between symptomatic and non-symptomatic. And at least in the Omicron wave, it's been usually about 85% asymptomatic.
Yes. Yes.
Right. I know you have to go, Dr. Shetty. So a last question of sorts. If you were to be addressing a child now, this audience is mostly, I'm assuming, older and adults. What would you tell the child? Children usually feed off the fear of their parents or grandparents, as the case may be. What would you tell a child who is perhaps a little afraid, unable to process maybe multiple emotions, wants to go to school, or maybe sometimes is comfortable just sitting at home because is now attracted to screens and those have become a part of life?
I would like to encourage all the children to go to school and convince their parents that they are safe, they are as safe in the school or as safe as they are at home. There is no difference. That's very important. And if the child starts demanding, believe me, most of the parents will agree. That is the first thing. Second thing is, the children should be, I want to reassure all the children that it's very, very unlikely. Now the COVID positivity in my hospital is 2%. So it's virtually not there. So essentially they are safe in the school and they are safe at home as well. But there is no additional risk for them to go to school. Having said that, they have to wear mask as much as possible, maintain the distance. And especially if a child is having some symptoms, irrespective of what the reason is, keep away from the school. And then they can go for the test if required. That's the only advice I have. I want to reassure all the children that they are all safe to go to school. And I want to reassure all the parents that the time has come for us to look at the education as the primary, the importance now, not the fear of COVID. And not to worry about the next wave. Even if it happens, it's very likely to be mild. Very, very unlikely to be like what we went through during the second wave.
Right. Dr. Shetty, thank you very much. If you are around, then I'm going to come back to you. But thank you, meanwhile, for your comments and thoughts. Seema, let me come back to you. As you look ahead, and in your report, you've done a look forward. And how do you respond to something like this? And let me pose the question in two ways. And I'm going to bring in everyone back again on that. One is, what are the key lessons from the fact that we've kept schools closed for almost 2 years? Secondly, how do we make up for this, if we can, and then we'll talk about how we prevent this in future.
I think we might all have different points of view on what are the key lessons, right? But I think for me as an educator, and just as context, we do a lot of large-scale work in Jharkhand, MP, Odisha, Rajasthan. And when you look at what's happening in schools there, what's happening in villages there, just the loss of education is humongous. There are districts in Jharkhand where there haven't been more than 100 cases in the entire district. And yet the schools are closed because the state of Jharkhand decided to close schools. And that has nothing to do with the state of Jharkhand. It is how decision-making happened, right? So as I look back, I would say, again, two things. We keep on saying two things. One, decentralized decision-making at all points of time. Secondly, schools be last to close and first to open, right? As Shaheen said, why is it that we prioritize media, entertainment, malls over schools? And what I worry about, Govind, as an add-on point to that, is that has school closures become a standard policy response for many other natural calamities? All of you are in Bombay, I'm in Delhi. Schools were also closed in November because of pollution. Now, I would argue that the pollution for most children is the same inside their home or inside their school, right? I, as a rich parent, might have air purifiers, but most of parents don't. In fact, I would argue that in schools now, kids are wearing masks. So they're perhaps safer from pollution at school than they're at home. So have schools now become the standard policy response for all natural calamities when governments don't know how to do anything? Provocative statement, but I would want us to think about that.
Okay, let's get a...
Yes, please. Yes, let's have that debate.
Yeah, let's get a few more views on that. Shaheen, you want to go first?
Sure. Govind, every day I read a new stat that makes me want to cry, but I think the one I read today is appropriate to respond to this. Learning poverty, or what we call learning poverty, right? A child not being able to read by age 10. In India, that was pre-pandemic at 55%. 55% of our 10-year-olds and younger were not able to read. The World Bank has said that has already in India increased by 15%. So I don't know if I can say more clearly how drastically we are impacting the future of this generation of kids by opening and closing schools in this way and not having the urgency and the planning. I think what Seema and I have spent a lot of time talking about is where were the guidelines as to when it's safe to reopen, when it's not safe to reopen, what data was being looked at, and why wasn't there more urgency? So completely agree. I just want to make one other point because of what I'm seeing in the chat as well. I think, that we're not comparing kids being locked up in their homes with not coming to school. We have opened our country fully. And so I think that's really significant. Sadly, this is not a pandemic that we can protect our children from anyway. The question is, in that environment, why are we closing schools and why are we closing them first?
Shaheen, why don't you take a stab at an answer as well?
What to do right now?
No, as in, why do you think we do this, or why do you think we did this?
I think one, a lot of misinformation out there that induced a lot of fear. I think the second is really the lack of courage in decision makers. The reality is, by taking a decision to reopen schools, you are going to have kids falling sick in school, and no one wanted that to be sort of on their government regime's hands. And I think those were two of the big ones. And then the issue of whose voice are we listening to? Which section of children do we care most about in our country? Are we, even on this call today, thinking about our own kids at home, or are we thinking about every child across India? And are we educating ourselves enough on the implications? I think if you understand the implications, Dr. Shetty, his exact words were, I guess it may have had some impact. This is not, I guess it may have had some impact. Studies are saying this could be 9 years of catch up for kids. 3 times the number of kids are suffering from mental health. The one that scares me the most in the report, there was a 490% increase in child distress calls to Childline during the pandemic. So we're talking about grave implications on our children. Now, equate that with what we're seeing most kids, even sadly, if they do get COVID, they're having a really rough 1 week, 2 weeks in most cases. It's sort of becoming a little bit like the flu. And yet we're not equating that and dealing with that with all of the other implications on children. So I just think we have to open, as Seema said, we can not shut schools unless there's a complete lockdown. If there's a lockdown, everything else is shut. Of course, shut schools. But if everything else is open, we need to open our schools.
Right. Dr. Vakil, so, between, again, I guess there are two kinds of students or subsets maybe. So one is those, as you said, want to come back to school, and that's what you're seeing in your school. But your school is in South Bombay. It may not mirror, let's say, what is happening or the approach that's being taken in other parts of the state of Maharashtra, or for that matter, in many parts of India. But there seems to be a definite problem about parents who feel that the digital exposure or digital learning is a sufficient substitute for what we've or what physical and real face-to-face education could be. How do we address that? Because to me, that suggests that there is it's also a lack of faith in the very concept of physical school.
Sure. I think virtual learning was seen quite excitedly by a lot of interest groups and by parents, and for a while even by students back in the middle of 2020. But very soon, I think the novelty wore out, and what was intended to be a stopgap arrangement suddenly became a long-term policy measure. That was the problem. It has delivered, depending on what socioeconomic class, what level of access you're talking about, it's delivered somewhere between 20 and 60% of the overall experience, leaving a substantial gap. And that gap was never going to be filled. The second mistake was trying to pose hybrid learning as another magical option, where a teacher miraculously has to teach 50% of the class in front of her and 50% at home, and cater to these two audiences who can't directly communicate to each other. Now, that is another technocratic, bureaucratic non-solution that very rapidly failed and shouldn't even have been tried, because in the West, people had said that it doesn't work. Physical works well, online works sort of, hybrid doesn't work. Yeah. So again, we keep trying to reinvent the wheel when things have been tested somewhere else and found wanting. Right. That having been said, I think, there are also some vested interest groups who want to disrupt schooling, unicorns among them, who will keep pushing for virtual learning as a standalone against all evidence.
Got it. Okay. Seema, do you want to very quickly come in on that? Is there, the counter pressure from edtech companies with all their front page advertisements and digital advertisements, essentially trying to create an alternate universe, which, I'm not getting into the right or wrong right now, but clearly that confuses the minds of parents and perhaps children too.
Yeah. No, and, I think Dr. Vakil made some really pertinent points about that. Let me, paint another picture. Let me paint a picture of, let's say, Odisha. And when you look at the mass of children who go to school in Odisha, and when you start looking at the digital availability funnel, it narrows very, very quickly, So what percentage of government school kids, and 50 to 60% kids go to government schools, right? What percentage of government school kids, their parents actually have a smartphone at home? What is that number? Out of that, how many actually have data connectivity on that phone? What is that number? Out of that, how many are willing to use that data connectivity for their child's education vis-a-vis everything else that they need it for? What is that number? And even if you give that phone to the child with the data connectivity, how is a 7 or 8-year-old supposed to use a mobile phone, watch a YouTube link, which is what was mostly happening in most schools, right? Government school systems, and learn anything. So I think while, EdTech can be somewhat of a panacea for a small part of India's students, I think when we again look at the mass, and I think if the story was even far worse than affordable private schools, because government school systems attempted a response. You manage 40,000 schools, 50,000 schools, and hence you try and put something together. Affordable private schools neither have the scale nor the capacity to do anything. So those kids perhaps suffered even more than government school kids, right? So like I said, I think pick a number between 70 to 90%, but we believe that's how many kids in India who got almost next to nothing over the last 2 years,
Okay, Shaheen, digital delivery or digital education in this case, it seems like a panacea. It works obviously as a defensive posture, and it did in the first half of 2020, towards the end of 2020. But we should have switched at some point, but we didn't. And that's because maybe we just felt that this looks like a long-term solution. That's reflecting our lack of faith in the original system. So how is someone like you working on this?
I think two things. One is we need to ask, what is the purpose of school and education? And when we start equating what EdTech can do, and I'm not taking away from what EdTech can do, tremendous things with content delivery, but school is not content alone, right? Which is what I think the point Cyrus made earlier as well. School is much, much, much more, and it's the unleashing of a child's full holistic potential. So EdTech at best can be a part of the solution, an important part of the solution, I think. The way we're thinking about it, and very early on, we said, can we pivot to a blended model, not as a Band-Aid, but as a long-term model, right? We learned a lot of valuable things during the last 2 years, most notably that learning doesn't have to happen in a classroom, and learning doesn't have to happen from the teacher who happens to be in front of you in the classroom. You can really learn from life any time of the day, from anyone, anywhere. And I think that's what a blended system allows. And so our hope is that, one, there is an investment so that in hardware for all children, so we don't leave, as Seema said, 70, 80% of our kids out, but that we over time thoughtfully train our teachers to say, this is best done in a physical classroom, and this actually can perhaps even be better enabled by technology. And what does that look like, both within the classroom and beyond? The caveat is, let's not invest mass amounts of money without a lot of thought and planning and just give digital access to everybody. I think it'll end up being quite a disaster. But can we plan towards a blended North Star? I think that could over time be a huge equalizer.
Yeah, but even, the subject for today is schooling in a post-pandemic world, and you've raised the moot point, or one of the many moot points today, which is, why do we need to go to school at all? And that, I think, clearly this pandemic phase has caused many parents to ponder over, and perhaps with not the best answers or the most encouraging answers, at least from a children's point of view. So how do we address that? And let me get everyone's view back in here. Seema, you want to go first?
So, Govind, I'm also a parent. I have to tell you, I'm extremely excited that my kids are back in school. I think it's honestly just so many things. The value of school, like we said, is far beyond education, right? It's the discipline. It's the discipline of getting up every day and, wearing the uniform and actually going to school. It is the social interactions that you actually have, across the school. So, and that is even for my children who have one room dedicated with 1 to 2 devices and very high quality Wi-Fi, through which, the content delivery can actually happen for them, right? So even for those kids, I value school immensely, and can definitely see the lack of holistic growth that our kids went through over the last couple of years.
Right.
So that's one end, but I keep on going back to, beyond the top 10%, right? Those kids were not even getting that. And I think it's a long, long time, no matter how quickly we invest in not just hardware, and Shaheen talked about hardware, but also content. Where is the EdTech content in, let's say, a Marathi or a Kannada or a, Manipuri when we need it, right? If you look at, for example, edtech content, and when we talk about, let's say, the concept of ratios, majority of the content, I can tell you, will talk about a pizza to describe ratios. 70% of the kids don't know what a pizza is. So unless you actually convert it into a Hindi and show a roti or an orange, you will not learn that. So I think I think edtech can be fantastic, and I do think that we need to, democratize education. We need to invest in hardware, software, content, all of it. But it's a long time, before all of that happens. So we should make those investments, but I don't think we're dismissing schools anytime soon.
Right. I mean, and I think Shaheen made a good point. I think the distinction between schooling and content delivery or content absorption, and why the two should be different. Seema, a point that you made in your presentation, I don't know, I think you just sort of touched upon it very briefly in the opening. So in other countries, we did say that we are only the second country or with the longest school shut period with schools shut. Now, in many other countries, clearly they moved faster to reopen schools. And in your report, you've quoted schools from the United Kingdom, even in Singapore, where these are countries which have gone for a zero COVID approach. Or I think you've talked about New South Wales in Australia. So, how did they do this, or what made them do this faster than us, and what are the lessons that we can take away if so?
In terms of school opening, like faster school opening?
I mean, how did the public health, public policy system, veer around to opening schools faster and focusing on schools being open or returning to schools as a priority compared to us, at least if you look at the data?
Good question, Govind. It's hard to sort of say, what went on in policymakers' minds, right? It's hard to kind of guess that. But I think I want to make 2 points, because there's a lot of commentary in the chat window about comparing us with developed countries. I do want to say that we've also looked at a number of sort of middle-income countries. We looked at Malaysia, we looked at Indonesia, we looked at Egypt, we looked at South Africa, right? So not just the developed world in terms of US, Europe, etc., Australia, Singapore, but we also did look at middle-income countries. And there were 2 types of countries. Yes, Bangladesh and Pakistan responded very similar to, let's say, how India did, but we also found a lot of middle-income countries where schools did open for large parts of 2021. Honestly, I'm going to take a pass on commenting on how these countries decided, what went on in the policymakers' heads, and it's hard to comment, but I would say that what we did see was school opening getting prioritized,
Right, and that's quite evident, yeah. Shaheen or Dr. Vakil, do you want to take a shot at that?
Cyrus, go ahead. You had your hand up earlier.
My hand up earlier was to really answer your question, what is the purpose of schooling? And I think, and it partly answers why I think they were more eager to open schools in the West. I think, the age of equating schooling to content mastery and assessment of content is well and truly over, with content ever so accessible now. So I think other countries have made the shift to teaching and assessing competencies and dispositions, skills, in simple language, skills for communication, skills for critical thinking, problem solving, etc. Right? Dispositions like curiosity, intellectual humility, research, etc. So I think, and that prepares you for life in a way that assessing you on content of what's on page 57 of the textbook doesn't. So education and schooling has found its purpose in other parts of the world. And in India, with the strong, with exam boards dictating what is schooling, we have yet to find our way to those new educational objectives. That, in my view, sort of summarizes why the West and India, society, parents, policymakers, etc., have acted differently.
Right, and I guess one of the policy posers from our point of view, from this panel's point of view, could be how do we change that? Shaheen, do you want to go first?
I mean, I just want to add like one important point, which became so apparent to me in the last 2 years. And every time I join a panel or speak as well, I'm looking around saying like, but why are we not talking to our children and asking them? So even the question you pose, like, does school matter? You need to just go out and talk to 100 children to say, do you want to go to school or do you want to sit at your home and learn? And you'll get the answer. But I think what I would most say to policymakers as a way forward is the paradigm shift needs to be, we need to understand what our kids need by asking them. And we need to then design around our kids, not our examination system, not our politicians, but our kids. And if we design the education system around the child, it sounds like a very obvious point, but I don't think most of our schools in the country design around our kids.
Right, and we're going to come back to that towards the end, as in and talk about how do we impress upon the policymakers these priorities, and maybe taking a few leaves from other countries, since we do take leaves from other countries in so many areas. Okay, there are a lot of questions that have come in. Many are health related, so we have no clear health person on the panel now to respond. So let me pick up on one or two simple ones. Vinaya Deshpande says, in Mumbai, where schools have opened, there is no COVID appropriate behavior, no masks, no social distancing. Isn't it going to increase the risk of spread of the virus a lot more? So let's keep the medical part aside. Dr. Vakil, how do you ensure that there is COVID appropriate behavior in your school?
Well, I think a lot of medical people have said that the most important thing is masking. So you reduce the essentials to one thing, masking at all times. And I think you are 3/4 of the way there towards safety. Expecting children to stay 1 meter apart from each other is a utopian hope. It's never going to happen. So let's not even attempt it. So I think we have to be practical on what is essential, masking, and what is good to have, right? Which are few other things. We have, because of the importance of masking, we haven't yet opened school all the way through the day because that would mean unmasking during a lunch break, which we still find is unacceptably risky. So we have to work on this balance all the time. When the numbers and the risks are even lower, in 2 weeks or a month's time, we'll start lunch also and unmasking there.
Right. Nidhi Mundra asks you, Shaheen, but sometimes the children don't know what they want. My 9-year-old would rather be online schooled, and it's become like a Stockholm syndrome for us. How do you ask such children who think online school is better because they can play video games while school is going on, or who've got addicted to their gadgets?
Yeah, I mean, it's a really difficult question. And again, I think one of the important negative implications of this, kids have just developed bad habits, as have all of us. It's an effort to go out to the office as well when it's been easier to sit at home. I think it's just going to be slow shifting of habits. And again, hopefully going back to schools that are reimagining a different reality and not defaulting back to being the poor quality schools that many of them were pre-pandemic. But I think for parents, just encouraging, nudging, building up confidence, talking about socialization, for schools to also think about how to integrate technology into schools, because kids are learning really well with technology as well.
Okay. Sri Lakshmi P asked, and I'll try and blend that with another question as well. After reopening, what kind of new strategies should education systems adopt in this perplexing situation where most schools are rushing to complete the syllabus and focusing on preparing students for exams purposes only, giving a complete emphasis on the results more than ever before? Dr. Vakil, do you want to pick that up first? I mean, balancing the rush to complete syllabus, give the exams, get the marks versus everything else that good schools want to do for children?
Yes. Yeah, this is worrying. And this idea of time loss, while it is real, I'm afraid that the policy response to that at the school level and at the government level may make the problem worse. Okay, it's a little bit like, you can't catch up on sleep that you've lost during the week by sleeping all the way through the weekend, right? So time lost is time lost. what you have to make sure is that you don't endanger the future by trying to catch up with the past. Shaheen and others have talked about very serious mental health risks, pressure that students were facing will now intensify if we ask them to run a marathon in half the time. And I mean, I really love the BCG report. The only part of it which frightens me a little is the part on the last page which talks about bridging the learning gap in mission mode. I'm very frightened when sort of, we talk about mission mode, because that's an invitation for government bureaucrats to sort of step in and make bad policy responses.
Okay. Seema, what were you thinking when you were talking about mission modes?
No, I think, Dr. Vakil, that's a very fair comment, and maybe we should have worded it better. I think the idea is, what we've all talked about. 2 years of learning loss cannot be looked, away at, right? One has to take cognizance of that. What is likely to happen in majority of the schools is that students come back, and within a few days, we almost start pretending that they were always in school. And, and like you said, we are in a rush and this is February, so we're in a rush to finish the syllabus. We're in a rush to kind of do the year-end exams, right? Not recognizing once again that for majority of our students, someone who's in grade 5 today was probably in school the last time they were in grade 3. And I think what we wanted to say when we said mission mode was that we need to recognize this learning loss, and we need to put adequate time and resources behind it and adequate thought behind it. In fact, I think it's in many ways, perhaps exactly how mission mode is normally thought of. We don't believe a 15-day program or a 30-day program or a 60-day program is going to address, what we've actually seen. 2 years of learning loss, will it take maybe 2 years for some kids? Perhaps, right? So, but the idea of mission mode, Dr. Vakil, was not about time but more about urgency. We do think it requires significant resources, significant thought, significant time, and significant customization. In one particular school, you will see kids who have come back and who, didn't clearly lose much in the last 2 years because they had enough academic support at home. And you will also see a group of students who lost a lot because they had nothing at home, right? And how do school systems now customize towards that? So I think the idea of mission mode, Govind, was about thought, resources, planning, and not looking away from the problem and going back to BAU.
Okay, lots of comments continuing to come in. So I'm going to pick up a few of them. So I think the larger issue that in a way I do want to come back to is maybe in some ways goes back to pre-COVID days. What is our school system like? What is the structure that we had to start with, and why is it that edifice seemed to have disappeared or collapsed so quickly? It did in other countries too, but it seems to have come back together. So why is that? And is there something about this period, like all corporations say that we've used COVID to re-engineer ourselves, and maybe they've done it too, looking at the way the markets are rewarding them. So can this be? Is there anything from this period that can actually be used to redesign education, at least in the context of India, when it comes to young children? So we're going to come to that, and that's maybe will be the last set of questions I want to pose. But before that, an anonymous attendee asks, why does school need to work 7 hours a day, 6 days a week for even 8 to 10 years old? That makes my son hesitant to go back to school. Dr. Vakil, I don't think do you work 6 days or 5 days?
No, we work 5 days, and we've actually found that, even releasing them at lunchtime now is working fairly well. I think we overdo the quantum, honestly, all over the world, not just in India. We can make do with less, but we can't make do with nothing, right? I mean, that's what we have learned.
Right.
We've also learned that doing things in asynchronous mode, that is, doing some classes and then expecting 10-year-olds to go home and sort of do assignments on their own, doesn't work. Yeah. So, right. Sadly, because it would have then ideally mixed our technologically driven learnings with physical school, and it would have been a wonderful blend. But if anybody has cracked how to make asynchronous work, please tell me. Yeah.
Okay, Shaheen, how do you see this? I don't know if it's a dichotomy or a conundrum. I mean, number of hours, number of days, is that itself causing too much pressure and maybe making parents rethink about sending their children at all?
I mean, I don't know about that, but I'm on sort of the opposite side of what Cyrus said. I mean, all the research I've seen, and maybe it's the children that we work with, indicates that we just need more instructional time. Like, we work in government schools where teachers get like 3 hours, 3.5 hours. And really, school is the only place to bring the world to children for many kids that don't have exposure and access. So I think I don't think it's so much about the number of hours. I think it's about like what happens, like why can our schools not feel like magic for the children when they come? And again, it goes back to, we think about them as content, exam driven, rote memorization. Of course, you don't want to be there for 8 hours, but if your school is truly holistic and mirrors what a child needs and a child's greatest potential, then you can easily spend 8 hours in school.
Right, and Inakshi raises that question and a comment as well, I guess. Is it possible to expect the fun, holistic quotient of schools, small concerts, sports, excursions to be reintroduced immediately, or if it didn't exist as such, then maybe introduced, or is that some time away?
I mean, you can probably guess all my answers by now, but I think in some ways that needs to be the first thing we do, right? Like that. I mean, and we need to stop seeing it all as separate. Like, really, you want to bring art into the content. You want to bring social issues and projects into the way children learn. And so can we think of that paradigm where these are not nice to have things, but they're dimensions of a human being, and all of that matters together.
Okay, Dr. Vakil?
Sorry, I was going to say, just from a public health perspective, I guess we just have to ask ourselves the question that Shaheen has been asking. Are we doing these things at home in our communities? So are we going to concerts at home? Are the kids going to play with other kids? Whether it's in the building park or, the public park or the village center, right? And if they're doing all of these things for the rest of the day, then why not in the school? Are you doing these things yourself? Are you allowing these kids to, allowing your kids to do that? And if so, yes, then of course it can happen in the school environment as well. I think it's just that simple.
Right, and maybe could that be sort of one of those pandemic learnings that, maybe schools need to become even more attractive as places, as physical spaces than they were before?
For sure. For sure. Dr. Vakil, sorry, I interrupted you earlier.
No, yeah, it does. And I think one positive lesson has been that certain things can effectively be done online. We can bring junior school and senior school together for a big event, even in South Mumbai, which in the physical mode would be impossible. We can do an art exhibition online with presentations in a way that wouldn't work in an actual school hall. So yeah, I mean, we shouldn't throw out the baby with the bath water. I think we should keep that 10-20% that has worked and go ahead with it. Whether concerts is part of it or not, time will tell. But we had absolutely heroic efforts from teachers and students to put on online stuff even during lockdown. So yeah, I mean, there have been positives, definitely.
Right, and as Shaheen adds in the text chat box, he says, each thing we take away, there's a negative implication. Taking away sports has led to an increase in obesity, screen time, to an increase in eye issues, etc. Okay, here's another point that's interesting. Tarani Devi DS says, I think proposing a COVID board in school is integral, both in monitoring children's adherence to appropriate COVID behavior and, most importantly, supporting the child whose peers and family fall ill. What do the panelists think about having a COVID board? Seema, do you want to go first?
I mean, I think sounds like a great idea. I would highly recommend that we include our students in that so that they're part of the decision making, part of the management, part of the response. And once again, it's not decisions or actions which are imposed on them, but they're part of it. It will also give them agency. It will give them new skills as well. But sounds like a great idea.
Okay, Shaheen?
Yeah, I mean, I just think it's a massive opportunity for the community to strengthen the school overall. A part of that is, how do parents, children, teachers take responsibility for COVID-related issues and protocols? A part of that is how do you put your heads together to be as creative as possible around how to bring co-curriculars back? So I think it just represents an opportunity for us to get engaged with the system as citizens and really ask ourselves, like, what can we do if these are issues in my school? And certainly oversight of COVID protocols, whether it's a separate COVID board or whether it's the existing school management committee that takes it on. I think schools should have flexibility in those ways, but a real opportunity, I think, for all of us to engage with schools.
Dr. Vakil?
We have a health and safety task force, and we've had one for over a year, made up of parents who are doctors, and they have been immensely helpful in guiding the school management and also, addressing parental concerns over time. So I think, and it helps to have medical professionals there. At the same time, I mean, they would obviously focus on the risks, on the health risks. Alongside that, we have to look at the educational risks of keeping schools closed or limiting schooling.
But you said you had doctors and you have doctors in your school committee. How have you found them in approaching this whole issue? Have they been, defensive, extremely cautious, or more playing on the front foot when it comes to reopening schools?
Well, I think, they have been very responsive to a dynamic situation. So, based on what's happening in the broader health world and in Mumbai, they have calibrated their responses, I think, very sensibly. And the fact that they are themselves parents means that, they can wear both hats, I think. So I think by and large, it's been a sort of very positive experience for them and for us.
Right. Okay. I'm going to pick up on some more questions as they come, but, let me bring you back to policy and bring all of you back to policy, because there are some things like the way lockdowns were mandated and our responses, public health responses were mandated by governments, whether it's state governments or let's say the municipal corporations or civic authorities, which automatically ensure that everyone had to fall in line. Similarly, the next time things go wrong, reopening of schools or ensuring that schools stay open will or could have to be pushed from a policy point of view as an important priority rather than as we've discussed several times now, a third or fourth level priority after malls and cinema halls. So how do we do that? And what are the key areas that we should be focusing on, and who should we be directing this angst, if you want to call it that, to? Seema, why don't you go first?
I think I want to sort of bat a little bit from the point of view of the policymakers as well, right? I think there was just a lot of public pressure on them, and it just seemed like the safest thing to do. So I think obviously the policy decisions have to be taken, at the central government, state government, and at those levels. But I think what we as the larger community needs to do, whether it is educators, education stakeholders, parents, is give them the comfort that that is what we want. Right? That is what we are expecting from them. And if they were to open schools, we would stand side by side with them to make sure that, we support those decisions and we address the challenges which might come out of that in terms of disease, in terms of kids falling sick, or, whatever it may be. So I think that is what is actually needed. A lot of the chat messages, in terms of some of the concerns around school opening kind of indicate to you what is the pressure that policymakers are actually also feeling when they actually shut down schools. So I think, honestly, that is where it has to start. The response has to be from central government and state governments, the ministries of education, as well as disaster management, public health, all of them coming together. But we all have a role to play in making sure that we communicate that this is what we want and this is what we will support.
Okay, Shaheen?
I don't know. It's such a hard question. Like the question I've been asking myself is, like, why do these decisions even sit in individual decision makers' hands? Because this is a fundamental right. Like, in many cases, we've taken a fundamental right away from a huge number of our citizens for 2 years. And so I think the broad question, I don't have an answer in my mind, is
Sure.
How do we really elevate the priority we give to and the understanding we have of what it means for education to be a fundamental right? I think a group of us have been talking about, can we put aside all of our differences, but come together in a campaign where we think about the role that we need to play in really putting our children first, given what they've been through. And so, the invitation on this call and beyond is to say, like, can we all come together to slowly start answering that question? What does it mean to put our kids first, to respond to their needs, to know that this is not going to get solved in a month or two, but it's going to be a long-term thing for us to make sure that our kids are not only catching up, as I think Cyrus has said, and not only that it's mission mode, but that we're really changing things for the better in education.
Okay, and I'm also going to use this to get your sum-ups. Dr. Vakil, go ahead, and I'm going to come back to Seema for the last word.
Yeah, on the policy question, I mean, Seema's BCG report made the wonderful point that policy making on these subjects the next time around should be very decentralized. And that really resonated with the libertarian in me. And I think decentralization doesn't just mean, doing it at the local level and the block level in the city, but I think it also means at the school level. Empower schools, give them choice, because anyway, schools are going to empower parents to make the final decision. So why should policy be dictating the tram lines so firmly? Because context varies tremendously, right? Almost no generalization in the COVID era applies to everyone everywhere. Yeah? So let's give up this centralized maa-baap sarkar policy making and sort of try and bury it, not just in education, but in everything else.
Okay, there are two comments, and Seema, I'm going to ask you to do a quick wrap of where we started and with your sort of recommendations. And before I come to that, so Sri Lakshmi says, I don't see the enthusiasm and participation from students in online mode as it was when online started, and even the mental and physical stress of children have increased much more than adults. Care, which is clearly reflecting in their attitudes and aptitude. What strategies can be advised to adults in handling kids nowadays, considering the stress on adults too? Okay, that's a slightly different and longer answer, I guess. I don't know if any of our panelists here want to get into it. Homi Khushru says, how about asking senior students to mentor younger children outside school hours? This process may benefit both. Shaheen, a quick response to that, and then to Seema.
Yeah, I just love the idea. I think, I often think we have 320 million children in the country who can be our partners in helping all kids get a better education. And peer-to-peer teaching, as Homi said, has been proved again and again to benefit not just the child being taught, but the person teaching. So I think we can do peer mentoring, peer teaching in school, outside of school. We can help kids in communities get out of school kids back. We're also facing, we haven't talked about it in this hour, a huge problem of permanent dropout from the system. So how do we get our kids back into the system? And I think children can play a very big role.
Right, and I'm hoping that maybe those who followed this discussion will use this as a start point to think about the structures to do that effectively. Seema, it's back to you.
Thank you, Govind. No, look, we started with saying, our schools have been closed for the last 2 years, and what does the next year and the next few years looking like? I think Dr. Devi Shetty was very clear in his comments around while he believed that a lot of the response in the past was expected and probably appropriate going forward, we can all be fairly comfortable from a public health perspective that schools can and should remain open. The risk to students is minimal. The disease progression has actually proven that, and vaccination need not be something that we necessarily need to wait for, with respect to kids. So that, I think, gives us a lot of comfort about what to look forward to. I think, and hence, if we can actually work with that as the base case, that our schools are now open and will continue to remain open, I guess the question for all of us is, how do we build back better? How do we make up for what we've lost? How do we use this opportunity of redesigning what we do, including technology, outside of technology, thinking about the school day, thinking about not just academic learning, but social emotional learning, activities, peer-to-peer mentoring. How do we put all of our heads together to say, what does a new education system actually look like? Like you said, many businesses have changed and transformed the way they did things, post the last 2 years. Can we make sure that we bring some of that change and transformation to our schools as well? Or will our schools continue to look the way they did earlier? So that would be my hope, that policymakers, educators, education stakeholders, parents, and students come together over the next few months and design a system which is just, truly more powerful than what we had earlier.
Right. On that note, I think this has been a very interesting discussion. My thanks to Asia Society for having invited me to moderate this as well, and also helping me learn more about what the issues at stake are, which I hope to use in my own interviews and conversations. On that note, I think we've heard many, many important points of view from both the health and the education point of view. I think the imperative that schools need to stay open is very clear. If nothing else, we can learn from examples in other countries. Equally, I think the importance of decentralization and having localized approaches and down to maybe even COVID boards too, so that parents can get the comfort that children are in safe environments might be a good way to go, even as we bring in an effective mentoring system between or across children themselves. And that might be a very powerful tool amongst many of the tools that have been proposed here. Thank you very much for joining us this evening, and hope to see you soon.